Hi everybody, it's Adam, and we are at the Mitral Conclave in New York City. We're answering your questions that were submitted at HeartValveSurgery.com. I am very excited to be here with Dr. Patrick McCarthy,
Thanks, Adam.
who heads the Bloom Cardiovascular Institute at Northwestern in Chicago. And a question, Dr. McCarthy, comes in from Ruth, and she asks, how bad does a mitral valve heart murmur have to be before I need to get it fixed?
It's a good question, Ruth. Actually, we hear that one a lot, and the answer is probably surprising in that how loud the murmur is doesn't really mean that much to us. It's just the murmur itself is the thing that gets us started to check it out and to follow it. Imagine you're driving your car and you hear this clunking noise, that's sort of the murmur. It's not like if the clunk is really loud that things are worse, and you may have kind of a quiet noise that may be really bad. So let me give you some examples. So aortic stenosis, which is very common, probably the most common heart valve, can be very loud murmurs, and those we usually operate. But aortic regurgitation, where the valve leaks, are very quiet. And so those may be a really important clinical problem, but the murmur is so quiet and all, it may go undetected for a long time, and when you finally show up with the murmur, indicates that you need to have an echo. But so the murmur itself, how loud it is, it tells us various things about the valves, but really when you get a full evaluation with an echocardiogram is when we start to make decisions. But it's a very good and very common question.
And so your recommendation, Dr. McCarthy, for someone like Ruth would be to get a regular echocardiogram?
So well, first is when people have a new murmur, like people have lived all their life, nobody found it, but then suddenly a new doctor or a doctor that they've seen says they have a heart murmur, it's time to get an echocardiogram. You want to look at those heart valves, you want to see what's wrong. If it's a patient that they have been following for many years, perhaps with a cardiologist, some people are going every 3 months, some every 12 months. You may not need an echo every 3 months, of course. And then if they've been listening to it and it sounds exactly the same and they know what it is, they may just say we're okay. But if it is getting to be every 12 months or if it sounds a lot louder, things are changing, and then they'll get an echo.
Great. Well, Ruth, I hope that helped you. Dr. McCarthy, I just want to thank you for your extraordinary support of our community, all the patients who have come to you. On behalf of them, all the people watching this, I just want to say thank you for
Thanks, Adam.
all of your help at Northwestern.
Thanks for all that you do for the patients.